Alright, so today I'm just going to discuss histiocytic sarcoma with central nervous system involvement in 6 cats. I might have to scrub back into surgery shortly, but I had a few minutes and I wanted to keep up with this. So if this is the only time I get to do it today, again, just want to make sure I'm getting through as many articles as I can. This is out of the Journal of Veterinary Diagnostic Investigation from 2023. Just to go through the abstract. This is not an open source software, so I'll only be able to go through the abstract and then just give you some of my thoughts about the paper. So in this paper, they characterize 6 cases, 4 from autopsies and 2 from biopsies of histiocytic sarcoma in the central nervous system of cats. All affected cats had chronic progressive clinical signs. 3 autopsied cats were euthanized because of a poor prognosis, and 1 passed away. Clinical outcome for the biopsy cases is not known in this paper. Tumors occurred in the brain of 4 cases, spinal cord of 1 case, and brain and spinal cord in 1 case. Neoplasia was restricted to just the central nervous system in 3 cases. Reported gross changes in the 4 autopsy cases consisted of neuroparenchymal swelling, with or without tissue paler or gray discoloration in 2 cases, and a yellow or dark gray mass in 2 cases. Histologically, pleomorphic round to elongated neoplastic cells with typical histiocytic morphology affected the neuroparenchyma and leptomeninges. Multinucleated neoplastic cells were observed in all cases. Neoplastic cells in all cases has positive immunolabeling for IBA1, immunolabeling for E-calhedrin, CD3, CD73, and MUM1 were all negative, which confirms the histiocytic origin. I do apologize for some of the background noise. There's someone mowing outside right now. So hopefully it doesn't distract too much and you're still able to hear me okay. So just going through aspects of the paper, one should know in preparation for boards. In dogs, reactive and neoplastic histiocytic disorders consist of cutaneous and systemic reactive histiocytosis, cutaneous histiocytoma, histiocytic sarcoma, and dendritic cell leukemia. In cats, histiocytic diseases are diagnosed less often and include pulmonary Langerhans cell histiocytosis, feline progressive histiocytosis, and histiocytic sarcoma. It's hard to diagnose interstitial dendritic cells from the macrophages, but the dendritic cell malignant neoplasia is thought to be more common. In dogs, histiocytic sarcoma is somewhat common and is fairly well described in the central nervous system, especially when compared to cats. And again, over a 22-year period, they were only able to get 22 cases within the central nervous system. For diagnosis, they reviewed H&E stained tissue sections, and then immunohistochemistry staining was performed on those stained sections. As far as the different immunohistochemistry labels used, there was IBA1, which is a histiocytic immunomarker. E-cadherin was used, which is a Langerhans cell immunomarker, CD3 for T lymphocytes, and CD79 for B lymphocytes, and MUM1 for plasma cells. In total, they had 61 histiocytic sarcomas diagnosed in cats, but only 6 were found within the central nervous system. A 7th case was previously diagnosed as histiocytic sarcoma, but with immunohistochemistry staining was found to be a B-cell lymphoma. None of the other 55 histiocytic sarcomas had central nervous system involvement, so a small percent of histiocytic sarcomas involved the central nervous system, and again only 3 of the 6 were primarily within the CNS. Magnetic resonance imaging was performed in 2 cases, and it consisted of contrast enhancing, hyperintense meningeal areas extending from the caudal fossa into the cervical spinal cord. Histologically, they state that all tumors were intraparenchymal and partially effaced the gray and white matter. This tends to be different than what we see in a lot of tumors in dogs, as most of them are extraaxial, although they are locally invasive into the intraparenchymal region. So I'm not sure if they're describing this as being intraaxial or extraaxial. All the cells were positive for the IBA1 immunolabeling and negative membranous immunolabeling for the E. cadherin CD3, CD79, and negative nuclear immunolabeling for MUM1, confirming their, again, histiocytic origin. The localization for the primary histiocytic sarcomas in cats was localized to the fornix, the cervical and thoracic spinal cord, and adjacent nerves and brain. In one of the cases, there was a telencephalic tumor that also affected the trigeminal nerve, the lung, and the kidney, which is consistent with disseminated histiocytic sarcoma involving the central nervous system. Two of the cases were diagnosed based on histologic evaluation of biopsy samples and was not the tumor itself. In cats, gross differential diagnosis for CNS histiocytic sarcomas includes granulomatous lesions, lymphoma, and also meningioma. However, meningiomas tend to occur as a focal mass with characteristic firm consistency, and this can be differentiated grossly from histiocytic sarcoma. Something else that could be considered for these cases is the Langerhans cell histiocytosis, which can lead to nodules in the lungs and occasionally other tissue. But again, because the E. cadherin was negative, it was thought that these were histiocytic sarcomas. So again, another fairly straightforward article. For those that are able to access this journal, going through the figures is very much worthwhile just because they have beautiful images, like, again, usual for neuropathology related articles. And the one thing I wish they would have elaborated on is if they thought these were intra or extraaxial. Looking at one of the figures, it does appear to be extraaxial with secondary intraparenchymal invasion, but based on the data provided, it's hard for me to say if that's true for most tumors. Looking at MRIs, most of the time the main differential diagnosis from meningioma is going to be histiocytic sarcoma, where there's this large extraaxial mass with marked contrast enhancement. It has been shown that cerebrospinal fluid could help differentiate meningioma from histiocytic sarcoma in dogs, but it wasn't looked at in cats. So it's hard to say if this would be similar in cats. That's what I have. Thank you for listening.